Welcome, both of you, today. Kristen is currently working at the Rural Health Association. She's got many years' experience in working with vulnerable populations, including older adults. She's using those talents there now as the Rural Health Clinic Network Director. She collaborates with the rural health clinics across the state to promote professional development, support their regulatory compliance, and implement strategies to improve patient outcomes. She's got 18 years experience working with these vulnerable communities. She has a Bachelor of Science in Psychology, a minor in Sociology, both from UTC, go Hawks. And she is also holds certification as a rural health clinic professional, along with several other evidence-based programs. So we are thrilled to have her here with us. And then we also have Dr. Jim Peterman, who, as I mentioned before, is a resident both in Suwanee and then also has a home here in Chattanooga. So we're able to get information from him on both sides of the border. So he has done extensive work with community outreach and community engagement on in and around the Monteagle area through Marion, Grundy, and some Franklin County initiatives. So we're excited to hear from both of them today. Kristen, are you ready? So my first question for you today is, in your role at the Rural Health Association and as you work with clinics across the state, can you provide an overview of the definition of rural and your sense of the challenges facing rural communities?
Yeah, well, so thank you again, Christy, for having us and for allowing us to talk about this topic that's important to both of us. At the Rural Health Association of Tennessee, we're a nonprofit, member-led organization with the mission of leading the way for healthy Tennesseans through partnerships, advocacy, education, and resources. So our members consist of rural health clinics, primary care practices, school health professionals, mental and behavioral health providers, community-based organizations, and anyone and everyone who's committed to the vision of Tennessee becoming amongst the healthiest states in America. So we believe in the power of listening and learning through service and advancing professional development and elevating the voices of rural Tennesseans. So we'll talk more about us later, but just wanted to provide that context for who we are. And to answer your question, what is rural? Rural is a term that can have many different things or mean many different things to many different people, to many different organizations, and to government. So trying to define rural can be challenging, especially in a nation with diverse geography and challenging demographic or changing demographics, I could say. So, but a precise definition of rural is very important to those interested in rural issues and those invested in enhancing the quality of life for those in rural communities. So federal and state policymakers, funders, service providers, researchers, all need a clearly stated definition to what is rural, so in order to prioritize funding, inform laws, and to look at allocation of resources. So some examples of federal agencies that we gain a definition of rural from are the U.S. Census Bureau, the Office of Management and Budget, or OMB, and the United States Department of Agriculture. So while some definitions of rural are very broad, such as what's merely left after you look at the urban area or urban areas defined, some government agencies have created very detailed and nuanced definitions of rural to inform rural-specific research, policies, and programs. And so to further drive the complication in the definition or defining, the agencies I listed above themselves have various definitions of what is rural. So the fact that there are so many different definitions can lead to some confusion. You may be researching or studying and find that different numbers for the same rural statistics and wonder which one is right, not realizing that they both could be correct based on the various definitions. So when researching rural statistics, it's important to understand the definitions that are used to ensure the comparisons are fair and appropriate. And for organizations working with rural communities, confusions can also be occurring. For example, when an agency may qualify for one rural program but not another. Other times, organizations might know that they fit within a federal definition of rural, but they may be surprised to not qualify for maybe a state definition of rural. And so in Southeast Tennessee, Sequatchie County is an example of that. Sequatchie County is defined on some federal lists as rural and on some states as non-rural, or vice versa. And then when it comes down to the individuals, the everyday person, the person who has lived experience, they may consider their community rural and may or may not be surprised to learn that it may not fit a particular definition of rural. So I just wanted to provide some context to that. It can be confusing. The textbook definition of rural refers to an area that's located outside towns and cities, typically characterized by lower population density, vast open spaces, agricultural landscapes, and smaller communities. These areas often have limited access to services such as healthcare, education, and public transportation, as compared to urban regions. So the not so complicated answer and reality in defining what is rural is that it really lies on the context of what someone is referring to. It's the what. What is the need, or what is the issue? It's the when. What point in time are we defining it? It's the where. Where is it located? And it's the why. What's the topic or need and the potential support that we're seeking to influence? All of this really plays a part when discussing what is rural. And as it relates to rural communities, there's a wide array of challenges as it relates to the overall quality of health for people who are living in rural communities. And in a healthcare context, which we're going to talk about further, rural areas face a lot of challenges like healthcare shortage of healthcare providers, making access to care more difficult for residents. And so I'm sure Dr. Jim will have some insight into as well.
Well, let me just say that was extremely helpful and certainly fits my understanding, which is to focus on context. So whenever you're looking for grants or doing any other such thing like that, doing research, finding out what the context is going to be absolutely crucial. One of the things I wanted to say, just to give you some background, I'm a medical ethicist. And I was thinking about the notion of rural communities from an ethical standpoint. And I'm just going to say something that might seem a little weird, but whether or not a community is rural from an ethical standpoint, I don't think is all that important, because I think what the primary importance is in the kind of conversations we're having here today is level of need. And it can look like, and if you start sort of thinking in terms of stereotypes, it can look like rural counties are worse off than urban counties. Well, there's a tendency in that direction, but you can find zip codes in rural areas that are way worse off than zip codes in typical rural areas. So there's those sorts of comparisons that you can make. And at least what I would argue from a moral standpoint is what's crucial is that we develop policies, rules, institutions that prioritize the highest need communities and the highest need patients. It seems to me when I look at how healthcare is delivered in the United States, the people with the highest needs are the ones at the end of the line. And it's not even clear that they're in the line yet. So the kind of work that you all are being engaging in here is absolutely crucial. But it's also true that that our healthcare system is fragmented. There are gaps of different sorts all over the place. So the comments that we make in the next few minutes about rural counties is not meant to say rural counties are the only place where there's high need. There's high need all over the place. And in a second, I'm going to say something about one particular rural county that's as healthy as any other county in the United States. So you can find lots of different situations that you're going to run into in the work that you're doing in and around Hamilton County. My suggestion is that you become amateur anthropologists. You can look at the data, and I would echo some of the earlier comments from this morning about data. Data is not going to tell you the whole story. I mean, whatever story you're going to tell is going to have to be consistent with the data, but there's always needs to be an explanation of what does that data mean exactly. And you can't figure that out on your own. And working with people in the community, if you take a particular interest in a particular community, I suggest you find a partner and become an amateur anthropologist with that person, sort of figuring things out.
Thank you. Christin, I think I saw head nods, so you agree with that line of thinking as well.
I do. I really appreciate him following up with that, because he's right. It is about the need and where the need is. And just for context, as example, here in Chattanooga, where I live, we have urban zip code that has really high health disparity rates. And so it really, when you're talking about an area, whether it's urban or rural, it's just really about meeting the need and having access to resources for the whatever underserved community we're talking about.
Thank you. Jim, what are the major barriers to healthcare access and drivers of health, in your opinion, in rural communities?
I'm using these slides. Most of them come from the Robert Wood Johnson Foundation County Health Rankings. And I'll just say, I'm not public health specialist. I'm by training an academic philosopher, and I've worked with the Office of Civic Engagement at the University of the South, worked with local communities. For me, the Robert Wood Johnson Foundation isn't the last word on any of these things, but they do an absolutely remarkable job of pulling together really crucial data across all counties in the United States. So it's really a useful tool. And if I had more time, I'd show you how to milk it for all the stuff you can get from it. But what I wanted to do today is mostly pull some of those slides up to talk about some of the trends and differences between rural counties and Hamilton County and the Southeast region. And I wanted to just start with this first slide, and it really goes to the point of, let's see, let me see if I can, yeah, I'll just do it this way. Here we go. We'll just look there. You can sort of see the middle and eastern Tennessee, and these colors are indicators of health challenges. The darker, chartreusey kind of color, this one in Grundy, means less healthy. The greens are more healthy, and the super dark greens are the most healthy. So Williamson County is the healthiest county in Tennessee. So if you want to start talking about healthcare equities, one of the things that's interesting to do is to go through all the counties you're interested in and compare in Tennessee and compare them to Williamson County. The disparities are huge. But the other point I want to make is that even within the group of rural counties around Chattanooga, there are differences there as well. One of the things I'd also say, sort of going back to the point before, there's some neighborhoods in these rural counties that are worse than what you find in Grundy County. But the least healthy county in this rural area is Grundy County. And you can see that by the markings. It's sort of consistently challenged in all of its zip codes. A place like Polk County has some higher income, wealthier areas that are somewhat less challenged from a health standpoint. But then was it Ducktown, Copper? What is it? Copper
Basin.
Copper Basin is the folks there from a health standpoint are worse off than folks in Grundy County. But anyway, you can see there's just a bunch of differences. So what I also wanted to do is to sort of go through some of those, and this follows it's a fairly standard public health structure that's that Robert Wood Johnson Foundation uses. It looks at health outcomes and then also looks at the factors that contribute to those particular outcomes. And so I want to move pretty quickly, just looking through some of these. So one difference that you can notice that I think is really important is the lack of sort of health infrastructure in rural counties. The one that I wanted to focus on here is just the primary care doctors. There's, of course, much more to the infrastructure than that. But the other thing to say that is connected to this is the counties that you're looking at that have no hospital and no ER. So that's a crucial gap. But it's also not just that they don't have an ER and they have to go somewhere else. If you don't have a hospital in a county, then you don't have a kind of robust primary care community working and living there. So primary care doctors in Hamilton County, one for every 920 people. In Meigs and Polk, you can see the difference. There are no numbers there for Grundy County, but that's just because of a data blip, as far as I can tell. My best counting from what I know is one doctor for every 4,500 residents. So I see it as worse than Meigs and Polk. Also dentists, and you can look at here at Meigs, one dentist for 13,270 people. If you think about how long it takes to pull teeth and whether you could even pull teeth for that number of people. So there's another indication of a difference, and mental health providers as well. Another number that I like to look at is preventable hospital stays. And there's some interesting weird numbers here, but if you look at Polk versus Hamilton County versus Grundy County, in Grundy County, there are more preventable hospital stays. Why is it that they're preventable, or how would they be preventable? If they went to their doctor, they wouldn't have to go to the hospital. This is Medicare data, but the University of the South's done some research that shows that this problem exists across all ages in Grundy County. So, Christin, did you want to make any comments about any of that?
Yeah, just to echo that that's similar across a lot of the rural counties in Tennessee, especially, the more isolated, the more remote, the more they are removed from a major metropolitan area. We do see, some of the numbers that you're speaking about as well, and a lot in West Tennessee as well.
Well, let's move over the next factor I wanted to focus on, and that's socioeconomic. And again, this is complicated. I pulled this from the Sycamore Institute. If you don't know their work, they're in Nashville, and they're generating statewide data that would have an impact on the kind of work we're doing together. So they're another sort of local go-to source for me. I picked this one just because it captured the thing that I wanted to mention here. And so that's poverty. When you look at sort of like, where people are well off, and it's the bluish colors where people are well off, you can see that centers around urban areas for the most part. It's urban and centered around urban areas. It's more complicated than that. But when you look at and this is an interesting thing that I don't know how to explain. When you look at the rural counties surrounding Hamilton County, then there's a left-right, seems to be at least a left-right difference of some sort. The counties to the west look like they're doing less well than the counties to the southeast. But at any rate, living in poverty is really a big factor. I mean, and it ends up not just meaning that you can't pay for your pharmaceuticals, or that you can't pay for your doctor's visit. It means that you can't do a whole lot of things. And also, I think when you look at sociological analyses of the thinking of people who are poor, their thinking to us, to those of us who are better off, might be that they're not doing the things that would be rational for them to do to take care of themselves. but it's really informed by the fact that they're moving from one set of needs to another set of needs that tend to be sort of crisis fueled. And so they're not able to think in terms of long-term financial and healthcare related interests. They're doing, I think, what's rational from their own point of view, but poverty can end up informing a lot of their decisions and also just what they're capable of doing. Christin, did you want to add anything?
Yeah, you're absolutely right. It's those social drivers of health, right? So when people are trying to figure out how to feed their children or how to make rent or how to afford childcare, then, focusing, or how to be a caregiver to a relative older adult, then focusing on their own health and the financial burden of their own health becomes very low on the totem pole for their needs.
Let's move on. So this is a slide on behavioral factors. And again, you can see it's interesting because on some of these, you can see similarity and you can see difference, not just among the rural counties, but also between the rural counties and Hamilton County. So I guess obesity is just a problem everywhere. And it's interesting to me that the percentage of adults who smoke in Hamilton is really substantially less than the surrounding rural counties. But that's going to impact their health and the challenges that they find. The other thing that was striking to me in terms of differences have to do with physical inactivity. And, at least from a certain kind of picture of things, you might think rural people are having to be out in the woods doing stuff and sort of going to be more active. And that at least doesn't seem to be the case. But that's also maybe connected to the difference between access to exercise opportunities. That's tends to be an urban thing. And the rural communities that I know of have been trying to kind of figure out how to address that. For any of you who know about the South Cumberland Plateau on top of the mountain, you know that for the last 10 years or so, they've been developing a rails to trails mountain goat trail that'll be 40 miles where people can walk and bike over a 40-mile area on top of and off of the side of the Cumberland Plateau. So, the other interesting one is that I think we need to do our local anthropology on is teen births. Super high in Grundy, not so high in Hamilton County. And then sexually transmitted infections, fewer in Grundy County and way higher in Hamilton County. So those are all, I think, interesting things worth thinking about. But as I say, those are data, and you can come up with some sort of abstract explanations of how that might be. But the best way to kind of figure this out would be to work with other people who know the community well to try to understand what the explainer is of, or what the explanation is of these differences. Christin, did you want to add anything?
No, you said that well.
And the other slide I wanted to bring up and talk about briefly was transportation. And that's been mentioned throughout all the sessions. And it's not I think it shouldn't be a surprise. It's a surprise to me that I don't think that the data that we need about that is been captured in a way that it needs to be. So this is just another slide from the Robert Wood Johnson Foundation, talk about physical environment. And they've got, a couple of different data points about driving. And, driving alone to work, that seems to be common between urban and rural communities. So that's not a big deal. But the long commute is the issue. If you're in a low wealth community where the only jobs have to be jobs that you drive to, and they're a fairly long distance. So Grundy County is an hour from one side to the other, and then another half hour or 45 minutes from one side to Chattanooga. So that's really a long drive. And if you're just driving by yourself, that's extremely difficult. The transportation issue that I see, and other people who sort of work closely with community members report in every meeting I've been to, is no reliable transportation, or reliable transportation and insufficient gas money, or there's a public transportation system, but it's too complicated to navigate. And the result of all this is that when I talk to people who are within the kind of safety net providers in the state or in the county, the Department of Health and the clinics, what turns out to be the case is that when they have people signed up for healthcare appointments of one sort or another, there's over a 50% no-show rate. So ability to be able to keep people connected with their healthcare providers is a huge challenge. So transportation is crucial. Christin.
Yeah, and I want to just, echo that, especially for older adults, the transportation is a huge barrier. And, for caregivers who are working and maybe they're commuting out of the county, just to be able to navigate those appointments for their older adults who live in more rural areas just really, really becomes a barrier to care, especially specialty care. So, maybe an older adult in a rural community can access care with a local provider, but when it comes to specialty care, if they have to see a cardiologist or a neurologist, or they have to access those types of services, then the transportation issue is just compounded upon that. And so it really is a challenge for, again, our older adults in the rural communities to navigate.
Right. And then we'll just add something to that. So the folks that I've been working with on the South Cumberland Plateau, the clinics are starting to work with Project Access, which was just sort of been centered in the large metropolitan areas in Tennessee. And so there's a Project Access program at Hamilton County. Unbelievable. So it's possible to get basically free specialty care. So we've got in Grundy County 2 free clinics, the Department of Health, and then a rural health clinic that's owned by a private healthcare provider. But the free clinics and the Department of Health need to be able to send their patients to specialists. And so now there's a way to do that. But the transportation is the issue. So you've got an hour and a half ride, and how are you going to get that ride? If you can't even get to your local provider, how are you going to get to your specialist?
Well, thank you both for all of that information. I think one thing that Christin mentioned early on in her opening remarks was just the importance of listening. So as a provider, if I have a patient who no-shows consistently, or a client who, isn't following whatever advice I've prescribed, whether that be eat fruits and vegetables or get 15 minutes of exercise, we can't make assumptions that people are able to do these things. If you're seeing someone who's frequently no-showing, the question is why, and how can we help get you here? Is it that you don't feel you need this treatment? And that's a whole nother discussion of, I really want this appointment, but I just can't get there. Is it an issue of daycare for children? Are they not filling a medicine because they need to buy food for children? All of those things are questions that we need to ask, but then we need to listen very intently to the answers. You all may have questions about how to find out more information, not only about this data, but about the different associations and regions or organizations, both nationally and regionally. And Christin and Dr. Peterman have given some great resources that we'll send out in a handout after the fact, going through all the different ways you can contact these organizations and how you can look at that data. To kind of ask this last question of each of them, Christin, what are the primary ways that we can support rural health in nearby counties?
Yeah, so I think the primary ways that you can help, especially those that are entering into the healthcare field, is to choose to either work and practice or complete an internship in a rural community. I mean, if you could really, live local and work local, that is huge to expand access to primary care or specialty care in a rural community. So just, thinking about investing that way with your profession. And then also being a voice, right? You talked about that, the importance of that, Christy, just being a voice for the rural community, whether you live in a rural community or you just have some interest in a rural community, but being a voice for the underserved communities with policymakers, with advocates alike, all of those things. If there's ability to volunteer in a community, to do like what UTC is doing, have a mobile health clinic in a community, just figuring out what it is you can do to make a difference for the quality of life for any community that is underserved in Tennessee, especially our rural communities. So I think that's just one of the things that you really can make a huge difference in.
And Jim, if you had, I know it's tough, but if you could pick one thing, what could we do to help the rural communities?
Contact me through my email, and I will get you see if there's a way to get you set up with really innovative work that's coming down the pike on the South Cumberland Plateau. I'm going to add some ands to my sentence, so I get to complete this.
Yeah.
We're working with the Department of Health. We're working with local philanthropy groups. We're working with the Health Council. We're working with the local clinics. And the idea is to build a community of health that goes beyond what we're able to do now without having to ask for millions of dollars from the government. By changing the way we do the work now so we can do it smarter, we can make a difference and be a model for other rural communities. So if you're interested in working on some projects, there would be lots of room for doing that. And if you're not, send some donations our way. I'll give you some local groups to donate to, including the Rural Health Association of Tennessee.
Absolutely. Parting advice or questions or slides or contact information, we will get all of this information out. I'd love to see if there's a question or two from our audience, if you two are okay with that. Sure. Does anybody have a question or comment?
This is Kathleen Jeter. I do. First off, thank you to Mr. Peterman and Christin for an excellent presentation. I put my question in the chat, just listening to both of you speak about what you're seeing in rural counties and the different drivers. I think the PowerPoint presentation, that data points really spoke about those drivers and how it shapes our health outcomes here in Tennessee. I'm just curious about how much emphasis is placed on digital equity, and would love to hear both of you kind of expound on that. Realizing that we have a huge digital divide, especially there's one in Hamilton County, so I could only imagine what it is in our rural counties, right? But what does that digital divide look like, and how it greatly affects a person's health? Thank you.
You want to start?
I can. That's a very good question. Thank you for that. There definitely are some digital divides across our state in every community. And, the pandemic has certainly highlighted the need to accelerate that. I think there's a lot of work been done in our communities across the state to address this, but the pandemic certainly accelerated that. And so from where I sit in healthcare and working with clinics and individuals, there is some movement towards expanding access to telehealth. That's in regards to whether it's covered by insurance and all those other barriers that you have to get through, but just how can people even have equipment and internet access to, to utilize telehealth as an example. So a lot of work I can see being done in this space, but we definitely have a long way to go.
Jim, your thoughts?
Yeah, I would echo all of that. I can just say, here's a sense of where we're at the moment. And Glenn mentioned the Department of Health's commitment to telehealth. That's real. It shows up in Grundy County. But just in the last few months, here's what we've been able to do, both in the Department of Health and also in one of the private clinics. Volunteer behavioral health has a relationship to those clinics, not by having a provider, but by having a care coordinator who can then, through telehealth, connect patients with counselors, and they can get the behavioral support that they need. And And I just wanted to mention her, and I hope you're proud of this. You may know her. Dorinda Harris is the family nurse practitioner at Grundy County Department of Health. She has an MPH from your program. So, and if you don't know her, she's brilliant. So she's somebody who's taking care of patients and thinking about the community all at the same time.
All at the same time.
But one of the things that she talked about in the last meeting where I was her ability finally to, when a patient comes in, to get him to see the dentist, to get him to get counsel from the volunteer behavioral health. She had a patient who could not get healthy until she had her psychotic episodes controlled. And since then, she's been on an upward swing because she's able to take care of her personal health care, physical health care, medical health care issues. So we are pulling together what are resources that are available in urban contexts, but we're getting them for the first time. But we'll be working on that down the line.
Well, thank you both so much. Again, this is just really gets to the core of why we sought funding for this mobile health program in the first place. I think if you're a student who's been online or faculty, there have been multiple examples of different research opportunities, different service opportunities, clinical opportunities. The door is open and there are so many ways that you can get involved. I do want to talk a little bit just for a second about all the different organizations that we've mentioned, specifically Project Access. We're looking forward to, in our part 2 of this symposium, having some organizations online who can really dive into the way that they serve, how they serve, and how we can offer those services to our neighbors in these rural communities. So be looking for part 2 in the near future. And it's really neat to see how all of this comes together and pulling together that thread of that interprofessional care. It really takes a village, truly, to serve these our communities, both in the city and outside of the city. So next up, that's a perfect segue into talking with Rebecca Pipkins. While she's getting her screen going, I'm going to launch a very quick poll.